Hello everyone. Today's topic will be about open heart surgery. We will learn what open heart surgery is and see how it is performed. Before we begin, please like the video and subscribe to the channel so that the video reaches other people who can also benefit from it. Open heart surgery is a medical term used to describe any type of surgery in which the chest is opened or surgery is performed on the heart muscles, arteries, or even valves. You should know that open heart surgery is not a specific procedure or a set of steps that the surgeon repeats. It varies from patient to patient based on the problem in the heart and the patient is suffering from. We will learn about the most common heart diseases that require open heart surgery. These diseases include coronary artery blockage, heart valve repair or replacement, pacemaker insertion, or if the patient is undergoing a heart transplant, which is the implantation of a new heart. There are many other diseases that require open heart surgery. We will now look at open heart surgery in the case of coronary artery blockage. It is well known that the heart is a powerful muscle that pumps blood to every part of the body, and the heart itself needs blood to nourish it with oxygen and nutrients. We have a very well-known artery on the surface of the heart called the coronary artery. This artery nourishes the heart and supplies it with the blood it needs. Sometimes, the coronary artery can become blocked due to the buildup of fat and cholesterol on the artery wall, which of course reduces or prevents blood from reaching the area where the blockage occurred, and the area will die if blood does not reach it as quickly as possible. In this case, the person must undergo open heart surgery. First, the patient is put under general anesthesia, and the surgeons make an incision from the collarbone to the end of the sternum, which is the bone in the middle of the chest. They then cut the sternum in the middle. Then, the surgeons place a special tool to separate the edges of the sternum from each other, thereby moving the rib cage and ribs away from the heart muscle. They then begin to open the pericardium, which is a sac surrounding the heart muscle and the blood vessels connected to it. Then, the heart and blood vessels are exposed in front of it. Before the operation, the surgeon takes a part of the blood vessel from the leg or arm to make a patch or graft, as we will see now. After identifying the area of blockage in the coronary artery, he sutures the part taken from the leg artery and sews it from the beginning of the blockage to the end in order to create a new direction or path for the blood to flow instead of the area where the blockage occurred. Then, the heart is returned to its normal position, the pericardium is returned and sewn, and two drains are placed at the site of the operation to absorb any blood and fluids that may accumulate in the wound. The ribs and sternum are returned to their place back to their place, and the sternum is sutured and closed with wires and pins. The rest of the tissue is returned to its place, the skin is sutured, and the surgical site is changed every day. This was the most important information on today's topic. Stay healthy, and that's it for today's video. I hope you found it useful. Don't forget to like and subscribe to the channel so you can stay up to date with everything new. And goodbye, friends.